Good evening, everyone. I hope we're all fine. So today we're going to look at part of your course, the PST 573 course, Policy Issues and Healthcare. And one of the topics we're looking at is healthcare focus on selected population of women. So we're going to look at a selected population of women that healthcare focuses on in recent times. By way of introduction, we know that there has been a lot of progress in public health, medicine and technology, and this has led to major advances in the prevention, diagnosis, and treatment of diseases in women. If you can remember when we did that course, women's health course, we talked about the reason why a lot of interest is being focused on women now, and as a result you also find out that there are improvements or advances in prevention, diagnosis, and treatment of diseases that occur in women. So as a result of all these, countless women are enjoying longer and healthier lives, as well as improved quality of life, unlike in the past. You know that in the past there used to be, for example, a very high risk of maternal mortality or maternal morbidity. But recently things are changing. It's not as if the maternal mortality rates are still not high, but not as much as we had in the past. Okay, so but even with all these advances in healthcare for women, there are still significant disparities in women's health and healthcare. You still find out that women are still more prone to a lot of conditions. Women still present with more health problems as compared to their male counterparts. Now, there are numerous individual and societal factors that tend to place women at greater risk for health problems and also increase their vulnerability to diseases, injury, and psychological trauma. If you remember in your women's health lectures, we talked about we mentioned some of the reasons why women are at greater risk for health problems. Remember we talked about the women's body system, their lifestyle, combining work with so many other things, family issues and all that. So women are more vulnerable to diseases. Now, while women on the whole can be considered vulnerable, we can say that yes, women on the whole are more vulnerable to health challenges as compared to men. There are still some subgroups of women that are more vulnerable than the entire women. Do you understand? There are subgroups of women that may have greater than average risk for developing health problems, and thus they comprise the vulnerable populations. So out of the entire women that are vulnerable to health challenges, there is a subgroup that is more vulnerable. Now, what does a vulnerable population mean? Vulnerability means susceptibility. It implies being at risk for health problems in this context anyway. Now, people that are vulnerable are more likely to develop health problems than the others. There are certain community and corresponding individual factors that are risk factors associated with the development of poor physical, psychological, or social health problems. There are many factors that can, you know what risk factors are now? Risk factors are attributes, characteristics, behaviors, or exposures that are associated with or lead to increases in the probability of occurrence of health-related outcomes. For example, you can say that older women are prone to developing osteoarthritis more than younger women. In this context now, age is a risk factor of developing osteoarthritis. You can say that light-skinned individuals are at more risk or are more prone to developing skin cancer as compared to dark-skinned individuals. In this case, complexion becomes a risk factor. Okay, there are behaviors. You can say that people that take alcohol are more prone to developing liver problems. In this case, alcohol intake is a risk factor, and so on and so forth. So what we are trying to say is that there are certain community or individual risk factors. When we say community, it can be a collective risk factor. You can say that people living in Ebonyi State are more prone to developing elephantiasis because of the type of water they use as compared to people living in Enugu State. These are community based risk factors. And we also have individual factors, the one related to the individual as in personally. Okay, so these risk factors are associated with developing and also remember that when we're talking about developing health problems, we're not just concentrating on having malaria or having diabetes, hypertension. When we talk about health cuts across physical, psychological, and social problems. Okay, now vulnerable populations are groups who are especially sensitive to risk factors and generally possess multiple cumulative risk factors. So people that are sensitive to risk factors are referred to as the vulnerable population. They have a greater likelihood, of developing health problems as a result of exposure to risk, or they may have poorer outcomes from these health problems than the rest of the population. I want you to note two things. They may have a greater likelihood of developing health problems. For example, if we're talking about liver problem now, you can say that a vulnerable population is a group of people that take alcohol. They are at more risk of developing liver problems as compared to the rest of the population. Another vulnerable population can also be referred to those that have poorer outcomes from these health problems. You can say that maybe everybody is prone to having liver problem, but when someone that is diabetic has liver problems, the outcome is poorer, or the prognosis is poorer in diabetic patients. In that case, diabetic patients are vulnerable to having poorer outcomes when they have liver problem. So vulnerability can mean that you are more likely to develop a condition, or may refer to how the outcome turns out in you have a condition. What is a vulnerable population? Vulnerable populations have a greater than average risk of developing health problems by virtue of their marginalized sociocultural status. These people are more at risk for so many reasons. They may be at risk maybe because of their sociocultural status. You know what that means. The social class they belong to in the environment, or their cultural status. They may also become more vulnerable because they have limited access to economic resources. Maybe they are poor, or even their personal characteristics such as age, gender, occupation. So these are the things that can make somebody more vulnerable. Their status in the society, where they live, their environment, their occupation, their age, their access to resources, and so on and so forth. Now, for example, an emergency room nurse may be more vulnerable to violence, okay, as compared to other nurses that work in the hospital, because in the emergency room you see people that are agitated and so on and so forth. Another example is that hospital employees and visitors are vulnerable to infections as compared to people that are not working in the hospital, or people that are not visiting the hospital frequently. Also, teachers in preschool and daycare are vulnerable to a multitude of communicable diseases because of their daily contact with young children. So I hope this gives you a clear picture of what being a vulnerable population means. Now, vulnerability is both an individual and a group concept. To be a member of a vulnerable population does not necessarily mean that an individual, in this case a woman, is in fact vulnerable. Let me give you an instance. Pregnant women are vulnerable to anemia. Yes, we know that. But a particular pregnant woman may not be vulnerable to anemia because of some genetic factors within her, or maybe her dietary intakes. So you can say that all pregnant women are vulnerable to anemia, but this woman, wow, is different because maybe she started early to boost her dietary intakes and so on and so forth, or that genetically she's not vulnerable. Okay, now let's look at the conceptual basis of vulnerable populations. There are some important concepts that form the basis of vulnerable populations, as in what and what do we look at before we say that, okay, a population is vulnerable? Are there factors or are there concepts, okay, that we use as a basis for our judgment to say that this person is vulnerable? Yes, there are such factors or such concepts, and they include risk, social status, social capital, human capital, access to care, and quality of care. What we are trying to explain in this slide is similar to, okay, maybe when somebody says, okay, a woman now says, my ideal husband, and somebody says, what concepts or what factors are you using to classify someone as being ideal? The woman can say, I'm using his physical features. Maybe is he tall, is he short, is he handsome? Or I'm also using his financial status. I'm also using his employment status. I'm also using his health status to classify him as being ideal. And that is what we are looking at now. We want to look at those things that we can use to classify a population as being vulnerable. Now, these factors influence vulnerability and are essential for understanding vulnerability, as well as the nature of healthcare for vulnerable populations. When we know these factors, it helps us to understand, well, when a particular population is said to be vulnerable, it helps us to understand better. Okay, is this why they said that this population is vulnerable? Okay. Now, these concepts and how they are linked to vulnerability provide a framework for describing women as a vulnerable population. Now, let's look at risk. Risk is an essential underlying concept for understanding vulnerable populations. I'm sure we've talked about risk before. Now, any person can be at risk statistically by way of having the potential for certain illnesses based on genetic predisposition. Now, everybody is potentially at risk for poor physical, psychological, and social health. Anyone can be vulnerable at any particular moment as a result of circumstances in their lives or response to illness or events. Everybody in this life is at risk of health problems. But these risks may change over time. As much as we are all at risk, everybody may not be vulnerable at a particular time. If you say that all women are at risk of developing preeclampsia, you won't tell me that my daughter that is 8 years is at risk of developing preeclampsia now. No. She's not up to the childbearing age and she's not pregnant either. So these things change, risks change over time. People may be more or less vulnerable to poor health at different times in their lives. And there is likelihood that some individuals and groups may be more at risk than others at any given point in time. Example, women who are in poor physical health, such as those having a debilitating chronic illness, may be at higher risk for poor psychological health, such as depression. We are all at risk, but these risks and our vulnerability changes over